Hi, first of all, I'd like to give a huge shout out and thanks to my Facebook friends and family who helped us to decide on this topic. All right, here it goes. The question to them was, hi, Facebook family and friends, which topic will be the most valuable to people experiencing depression at this time? Please let me know a number based on one, two, or three. So number three is the winner, knowing when to get help. And special thanks to my husband, Sean Lloyd, his sister, Heather, his mom, Denise, my mom, Kathleen, my aunt, Anna, let's see, Fawn Stratton, Professor Wilner, Alexandra, Amanda Lee, Valerel, Janice Buffalo, Anna Kalinda, thank you, Auntie, Lisa Black, and everyone who participated. We have number three is our winner. All right. My uncle said that I need to make videos, Uncle Tony, that I need to make videos that includes a little bit about who I am and what gives me some sort of credibility to share what I have to share. And I came up with just a little brief introduction. I am Tonia Robinson Lloyd. I have a master's in clinical psychology, which allows me to practice clinical psychology or be a clinical psychologist for Caribbean nationals. While I'm here in the US, I am licensed as a drug and alcohol counselor. More excitingly, I get to work with students, their families, as well as teaching staff and professionals for the Robinson Lloyd Resiliency Group, where I've created the Resilient Stars program, a social emotional as well as academic coaching program. It's an awesome curriculum that we've seen helping hundreds of children as well as hundreds of staff to increase their grit, their self-esteem, as well as their self-regulation when it comes to anxiety and depression. I've been a mental health professional for just over a decade now. It's been fun. It's been a lot of research, a lot of mentorship, a lot of humility. Just the depth of love, the trust that our clients give to us. It's just the most beautiful and most cherished thing, and of course seeing them evolve to being resilient stars. Okay, so let's hop straight into this this topic. How do I know when to get help? How do I know when to ask for help? Okay, so we have some telltale signs I'm going to share with you based on my experience. Typically, if you go to see, you go to crisis, let's say that you go to the hospital, they're going to usually ask you for the past 2 weeks, how have you been feeling? So let's use that 2 week baseline, right? And so you want to start with the Maslow sort of hierarchy of needs, right? That pyramid of needs. Let's start with your basic needs. Are you getting sufficient sleep? Are you feeling safe? Are you getting sufficient food, right? Do your energy levels feel low? Okay, so let's look at those three things. Typically, when people start complaining of mental health concerns, they don't think, oh, you know what, I haven't been sleeping for the past 2 days, the past 3 nights, the past 2 weeks, right? So make sure you have really good sleep hygiene. Sleep, as you know, really helps the body to repair, particularly something called rapid eye movement sleep, right? That's literally the phase where the body heals and repairs sore muscles, joints, you name it. You may have dreams even helping you to resolve things that's taking place within your actual life. Okay, the food piece. Are you eating on time? Are you having monitoring your diet, right? Have you been just sort of not eating, skipping meals completely, not drinking water? Right? These are things that you want to make sure just walk around to like me. Just keep that bottle handy. Walk around with that bottle of water, right? So so we're talking about the food intake. Please make sure you have a minimum 2 meals and that you're sort of really taking time to take care of yourself. The third factor that we want to is safety needs. Have you suddenly started wondering if your family is trying to poison you? or if your friends are talking about you, or if people just don't like you and you really know it, you're convinced about this. If you're starting to have thoughts that others are trying to harm you, it's a good time to document this, make a journal, and try to test that. Try to list instead. Write both thoughts down. Here's what we don't want to dismiss your thoughts. Maybe they are all conspiring to harm you. Okay, maybe they are. I don't know. So let's do this. Let's keep a book of let's call them unhelpful thoughts, because they make us feel really sad if we think everybody's trying to harm us, right? So unhelpful thoughts as well as helpful thoughts, right? And list all of the unhelpful thoughts, and then see if you could find maybe a different reason why they may have reacted like that to you. Maybe they were just having an off day too, right? So we want to be a little bit more compassionate to thinking the worst of other people. And if we're doing that a little bit more than usual, we want to check that in. So here's the biggie. Here's the biggie. Suicidal ideation and homicidal ideation. Suicidal ideation means that we start thinking things like life would be better off if I were not around. Or if we just lost a loved one, it's COVID season. We've been losing people or hearing about people who we know that may not be with us, right? And it's a very, very painful time. Have we started to think things like, maybe it'll be better off if I weren't here? And are we having that conversation a lot? Have we started giving away our personal things, making plans that bye, treat me as bad as you want to, I'll be gone, right? So if we're starting to think like that, definitely, definitely, definitely go to crisis, call a hotline. A lot of people, particularly in the States, they say, if I share that I have these thoughts with crisis, they'll call DIFUS on me. No, you are showing that you're responsible, that you're getting the help that you need, that you're being a good parent by getting help. You're not going to lose your kids by saying, I need some help. No, that's not going to happen. All right. Homicidal. You really, really start, you're plotting. You want to harm someone else, right? Maybe it's that guy who just took your girl and you were really in love with her, or the other way around, or a girl took your girl, or whatever it is, right? Whatever it is, you're really pissed off and you want to hit somebody. Or you found out something that, might make you want to hit somebody naturally, like somebody sexually abused a minor, and it's so gross, and it's like, ugh, like you really want to harm this person, right? So we don't want to make an already bad situation worse, right? There are other ways that we could advocate for things, advocate for change, within our countries, within our communities. Be that voice, be that person who says something that's the right thing, even if it's not the popular thing. That's something that we could do instead. Right. And so those are definite telltale signs. So we started with the Maslow's hierarchy of needs. We got into the thoughts, the really, really unhelpful thoughts, paranoid thoughts, or, suicidal, homicidal thoughts. Next, the next level, we're starting to see things that other people can't see, or we're smelling things that other people can't smell, or we're hearing things that other people can't hear. And we are convinced beyond doubt that these things are real, and other people are saying to us, no, we're not hearing those things, right? And so, Trinidadians, we would probably want to go to see a priest first. And if the priest says, it's spirits, the priest might, or a pundit or the imam might try to get those bad spirits off of us. And they are also supposed to be trained to tell whether it's a spiritual situation that they're dealing with, as opposed to a mental health situation. All right, so if you're more comfortable going to your priest and your priest says go to your GP, please go to your GP. Your general practitioner or your doctor is going to be able to help you, perhaps use medication to help you through this season, right? So research says that the best some of the best coping strategies when we realize we need help would be the talk therapy combined with the medication therapy. And of course, there's a lot of very deliberate things that have to be done with medications. You have to be very vocal with your doctor about any changes that you've observed, right? Be very vocal and advocate for yourself. All right, so this is pretty much, the three core things we want to look for: changes in sleep, diet, and safety, changes in the types of thoughts that are constantly bombarding us: homicidal ideation, suicidal ideation, paranoia, seeing and hearing things that may not be there, right? Within the states, we have suicidal hotlines. Please make use of those hotlines. Within Trinidad, we have the Mount Hope, we have Chicotas, we have major hospitals with behavioral treatment units, absolutely free treatment. We also have our own. I would say, you want to probably not call the police. You want to, I mean, all respect to of course, to the police, they mean very well. But in terms of just getting to the right feeds, in terms of the type of help you need, your priest, your pundit, your imam, they may be able to signal to your caregivers, people who care for you, to take it to the next level. Go to see your doctor. Start with your general practitioner who knows you, understands you, has made time for you over the years, right? And take care of yourselves. Okay, it's okay to need help. Physical health is just as important as mental health. And to quote Professor Gerard Hutchinson, there is no health without mental health. I'm Tonya Robinson Lloyd. I'm hoping that this has been a very helpful video for you. Please let me know. Constantly working on sending information that's valuable to you. I appreciate your feedback, and have a really good holiday season. Please take care of yourselves. Bye for now.